Good morning.
Good morning. Welcome to the OBRA office.
And who are you?
My name is Quinasha Williams, and I work for OBRA.
So nice to meet you.
Nice to meet you too.
Good afternoon, everyone. My name is Angela Howard, and I'm the OBRA Pass-Out Director for the state. When you hear OBRA, it stands for Omnibus Budget Reconciliation Act. Think of it as the Nursing Home Reform Act of 1987. We're located in the Montgomery Central office on the 3rd floor in Suite 368. My role as the OBRA Pass-Out Director is to ensure we have a fully operational pre-admission screening program for the state of Alabama. We are a federal program and a state requirement, and we screen for 230 Medicaid certified nursing homes. Our main duties will all center around screening activities. Here in Alabama, we have a two-tiered screening process. We have a level 1 identification form, and we have a more comprehensive level 2 evaluation. When I say level 1 screening form, what its aim is to identify persons with mental illnesses, intellectual disabilities, and related conditions. And if those conditions are suspected, then the person would require a more comprehensive level 2 evaluation. That level 2 evaluation, it will either confirm or disaffirm diagnoses of mental illness, intellectual disability, or related condition. And it also determines if that person has a nursing facility level of care. And if they do have a nursing facility level of care, then we determine if they need any mental health supports while the person is in the nursing facility. We also consider things like the Olmstead legislation, for example, the least restrictive environment. So that will be the more comprehensive level 2 evaluation. We receive referrals from a number of sources. The two top referral sources are going to be the nursing facilities and the hospitals. We also receive referrals from places like home health agencies, hospice agencies, physicians' offices, Department of Human Resources. Well, if you have a loved one who needs nursing facility care, one of the first things from a pass-out perspective, they're going to need that level 1 preliminary tool. So if you're thinking, where do I get that level 1 form or who completes it? If you go to any nursing facility or any hospital, they're going to be familiar with the level 1 screening form. And any mental health or medical professional can complete the form as long as they have access to the comprehensive medical records. No, and on occasion I do get asked that question. But we have a wonderful resource. It's called U.S. News Best Nursing Facilities. So what they do is they rank nursing facilities based on short-term care, like if the person needs a little physical therapy, occupational therapy, or even speech therapy, and they rank them based on long-term care and residential. And they get this data from actually CMS programs, and CMS is the entity that makes and enforces nursing facility standards and requirements.
So you've worked at the department for how long?
Oh gosh, time flies, at least a decade. I've been here a while. I would have to say the volume of different types of tasks that we have to complete, and also the frequency of new cases that we receive. For example, on a daily basis, we receive new pass-out applications every 30 minutes to an hour, and this is on a daily basis. And we also receive cases 7 days a week, not 5 days a week, because nursing facilities and hospitals never close. Also, for every single holiday, on the day that we return, we still have to process the holidays work. So we're processing 2 days on one day. So we come in a little earlier, and I try to make sure we have enough coverage so it's not overwhelming. We're also required to provide a technical assistance line. So we have a 1-800 number for all 67 counties, and they call us on a daily basis. Coupled with that, We also have tracking reports that we process. The 230 Medicaid certified facilities, they send us tracking reports in on a monthly basis. The most rewarding, I would have to say, I see OBRA as a means of advocacy and protection. When I think about nursing facility residents, I think about some of the most vulnerable people in our society, and we have an opportunity to make sure that their placement is appropriate. We also have an opportunity that if persons with mental illnesses and intellectual disabilities are in nursing facilities, if we make recommendations, those recommendations go into the person's care planning. So that's very important. So I feel like we're also helping to increase the quality of their life, because when you think about OBRA, we were actually enacted in 1987 because there was a national outcry for more federal oversight in Medicaid certified facilities. So when I think of us, I think of advocacy and protection, and that's pretty rewarding.
My name is Amanda Talley, and my title is Planning and Quality Assurance Specialist. Okay, so I would say my top two responsibilities would be processing the level 1 cases, and that consists of the level 1 screening is a form that identifies suspected or a history of mental illnesses, intellectual disabilities, or related conditions. And I also track the monthly reports, and we're tracking all residents' movements in and out of the facilities that are confirmed level 2s with mental illnesses, intellectual disabilities, and related conditions. I would say new opportunities definitely brought me here, and I was previously with Alabama Department of Senior Services, so I definitely felt that the knowledge and skills that I had at my prior job would transfer to OBRA. Yeah. I would say the most challenging part is trying to find an effective way of multitasking, because the phones with the technical assistant questions that we have from the nursing facilities and the hospital social workers, and also trying to juggle the level 1 cases, and also the Q&As that we have. I would say those are kind of the most challenging part, but I figured out a system.
Great.
My most rewarding part is knowing that individuals who aren't able to effectively care for themselves at home are able to go into a nurse facility and get the effective care that they need.
My name is Talley Pierce, and my position is Quality Assurance Specialist 2, and I've been here for 23 years. I did retire, but I'm lured back because I love what I do. Right now, my main responsibility is to review medical records, make decisions regarding placement in long-term care facilities for anyone with intellectual disabilities or related conditions, and mental health issues and behaviors, to ensure that they are placed appropriately, and the nursing homes can provide the appropriate services for these residents. Oh goodness, 23 years ago. Actually, my background is in nursing and social work, and so I had a little bit of everything. I've worked in nursing homes with dementia patients. I've worked as a psychiatric nurse, and so that brought me, basically I was interested in the program because I worked with the previous director through the nursing home when I was working in the nursing home, so I knew the program.
Yeah.
I think the most important thing that has transpired has been the technical side of what has transpired over all these years. When I first came here, we were doing everything by fax. It would come over on the fax machine, and then we would hand write the determinations and fax them back. Mm-hmm. And this was for all the hospitals, the nursing homes, doctors' offices, home health agencies. So that we started there. Then all of a sudden I got a command central. I got 2 computers, and I was able to actually do the determinations on the computer. We were still getting them through the fax, but I was able to do them on the computer. And I was able to follow the database, which was really helpful. Then through the IT department, and specifically Charlie Gillis, helped us get into the internet. So now we have the capability of having service to our stakeholders 24/7. We do not see every single one anymore. We're only getting now through what we call an extract that gives us just persons that have suspected intellectual disability related conditions, mental health issues, and behaviors. So we get to see those. We can concentrate on those instead of having ones that are not requiring our services. So it's just been a wonderful advance. The telephone, it is, we provide technical assistance for the 8 hours we're here, and it is a constant ringing of the telephone, and we can do anything from 30 calls a day up to 80 calls a day, especially after holidays. But the phone, obviously giving technical assistance is extremely important, but it can become very difficult in trying to do other tasks and to also do the telephone and make sure that you're giving them appropriate information. I think I was thinking about this, and actually to have some family member call me and say thank you so much for what you did, we appreciate it. Also, I do the training for this office, and to see the new employees enjoy what they're doing after they've learned our process. So I would say training is one of my, I enjoy that very much because I like the results, and just to get the acknowledgement that we've made the appropriate decisions for families and patients.